Good afternoon. Welcome to another edition of Detox Directive with Dave. Today I want to talk about precipitated withdrawal, which is a condition that is typically brought on in an opiate dependent individual, not opiate dependent, really more proper to say in a fentanyl dependent individual that's brought on with the administration of buprenorphine or Suboxone. Fun fact about precip is that this is a phenomena that didn't even show up until fentanyl had been on the scene for a little while. Back through the OxyContin phenomena, we were detoxing lots of patients with Suboxone, buprenorphine, and there was no precipitated withdrawals bringing people off of oxycodone, nor has there ever been off of morphine or heroin either. It just has to do with the fact that fentanyl is the most potent opiate on the planet. So this is a phenomena that's been in existence for probably 6 or 7 years now, since fentanyl has been available on the street. What happens is the buprenorphine displaces the fentanyl off of the opiate receptors. Buprenorphine has a much stronger binding capacity. It binds to those opiate receptors much better than fentanyl does. So it knocks the fentanyl off of the receptor, and buprenorphine as a drug is not nearly as potent as fentanyl. So when you have fentanyl users who have very high tolerances, which would typically be daily users that are probably doing 0.5 gram a day long term, or they're high volume users of like from 1 gram to 3 grams per day, everyday type of users. They have so much fentanyl built up in their system that their tolerance is through the stratosphere. So if that individual is given buprenorphine, it knocks most of that fentanyl off of those opiate receptors. And guess what? Buprenorphine isn't nearly as strong as the fentanyl. So that immediately throws them into severe opiate withdrawals. If I had to put it in a word to simplify the concept, and this is especially for the people who experienced precipitated withdrawals before and don't want to experience it again, the old saying, slow and steady wins the race, is applicable. So when a person is coming off fent with a heavy tolerance, with a heavy habit, if the withdrawal process is done slowly, then you stand much better odds of not putting that person into precipitated withdrawals. And so by that, what I mean is, at the facility I worked at, we, in addition to buprenorphine, we also used non-opiate based medications for withdrawal, such as baclofen and clonidine. Those are two medications that will only help with opiate withdrawal symptoms. Those two medications will never put a fentanyl dependent individual into precipitated withdrawals. So if we start out with those medications before administering buprenorphine, then we buy time for the fentanyl to naturally come off the receptors and come out of the person's system to get their tolerance level down to a reasonable dose, where once you then do start buprenorphine, you have much less likelihood that it will put the person into precipitated withdrawals. Suboxone is more likely to initiate that phenomena because it has a tiny dose of naloxone in it. But in a medical detox setting, we never used Suboxone in that setting. Suboxone is typically used once patients are transitioned out of detox and into a outpatient rehab setting or into a residential setting. Then the doctor would transition that patient from plain buprenorphine to Suboxone. So for detox purposes, only buprenorphine is used. But the more time that the patient is able to buy before starting buprenorphine, the better, and the less likelihood of having the phenomena of precipitated withdrawals occurring. And so really, like in heavy users, typically they really need to buy, a lot of times they really need to buy 2, 3, maybe 4 days of using non-opiate medications such as the baclofen or clonidine before starting buprenorphine. Or they could, if a patient could do dose reduction on whatever their habit is, whatever the fentanyl that they're using, then that would work too. But the reality is, nobody addicted to fentanyl is ever able to do dose reduction. If they could, they wouldn't need to go to a medical detox unit to begin with. So slow and steady wins the race. Take your time. Don't be in a big rush. That's easy to say. I think a lot of times in facilities, time is of the essence and people want to get things moving. And of course, the client, the patient, wants to take the buprenorphine to just feel better. Once they experience the most minimal of withdrawals, they want to feel better immediately. They don't want to endure any degree of suffering. But rushing on a heavy dependent fentanyl user, rushing in the process of starting buprenorphine is a mistake. And the sooner you rush that process, the more you increase the likelihood of precipitated withdrawals. A lot of times in the unit I worked in, we would be starting in a day or a day and a half. And in a moderate to light user of fentanyl, that works, and that's okay to do that. And you don't have too many instances of precipitated withdrawals. But in your heavy users, they need more time. They need more time. So yeah, slow and steady wins a race. It's a process. It takes two things to properly detox: medication and time. If fentanyl addicted people could be detoxed in 1 or 2 days, why in the world would we ever take 3 or 4 days? Or why in the world would we ever take 5, 6, or 7 days, 8 days for heavy users? There's no reason to drag it out, but to do it humanely, time and medication are the prerequisites. So I hope this helps people. If you're in the hole, don't give up. Be encouraged. Just be realistic in knowing that you're going to need a medical detox. process to break free from it initially. And then after that, rehab. If you've never done rehab, then you should certainly be looking at and willing to engage in some format of rehab, whether that's outpatient or residential. The format is not as important as the willingness to do the rehab. And the counselors will help you figure out what format is appropriate for you. I hope this helps somebody. Don't give up. Keep trying. Thank you.